Hello, 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 ATHLers, my beautiful friends and family. Happy Friday. It is the last Friday in January. I'm just here to say happy Friday. I'm going to be talking about our topic today is cervical cancer. But first of all, happy Friday. And for those of you who are in areas where it's going to be snowing heavily, the blizzard and all, make sure that you are prepared. I am sure by now you've all gone down and gotten all your necessary supplies, your bread, your milk, your food, and other necessary. Make sure you have all your medications. I'm sure you have called your doctor's office and you got your refills and everything and picked it up, especially for those of you who are on insulin and time sensitive medications. So I hope you've gotten that already. Make sure you have enough gas in your car. If you're going anywhere, if you have to travel, make sure you have like blankets and some food and other things in the car in case if you get stuck going from places, you get stuck in the traffic and it's snowing. So you want to make sure that you're taking good care of yourself. So as I wrote before, if you're going to be plowing the snow, just make sure that, especially for men of a certain age and women of a certain age as well, that you are giving yourself time to plow the snow, take breaks, take making sure you listen to your body, because most people have suffer from heart attacks during this time when they're plowing the snow and shifting snow continuously. So make sure you're doing that as well. Okay, so I am going to be going to the topic of the day. January, I was going to do this at the beginning of the month, but there's so many things that go on. So I decided to just do it at the end of the month. January is Cervical Cancer Awareness Month. We hear a lot about breast cancer, but we don't talk that much about cervical cancer. I don't see too many topics about it. It's one of those gynecological cancers that doesn't get that much play, but you do hear about it when you talk about the HPV virus. So, again, hi. Thanks for joining me. For those of you who will be joining me during this broadcast, I say thank you. I know it's Friday and there's so many things, but I'm sure most of you are home and staying warm. For those of you who will be joining me during this broadcast, I say thank you. For those of you who will be joining me after, I say thank you as well. More people watch after I get off. So, anyways, okay, I'm not going to make this too long, no more than 30 minutes or so. I'm already 2 minutes into it. So, again, January is Cervical Cancer Awareness Month. This is for women, but also if you're a man, you have women in your lives, you have your wife, you have your girlfriend, you have other people that you care about. So, any information here, if you're listening, you can always pass it on to those women in your life, people that you love and care about. Okay, so my introduction, my name is Abby Tyler. I am the administrator of this group. I am a family nurse practitioner. I practice in a private practice in Philadelphia. I also come with a 22-year RN experience, and I do some volunteer work in our community. I am married and a mother of two. So, and my disclaimer, as always, this is for informational purposes only. So, whatever I say here, you're making sure that you check all this information with your primary care provider and your OBGYN as well. Okay, so because it's a topic about gynecological issue. So, with that being said, we'll get into this. So, I'm going to be reading back and forth too. Okay, so all my information, I'm getting this from the American Cancer Society, my training, family practice training, American College of Obstetrician and Gynecologist, and United States Preventative Task Force, and the CDC. So they recommend CDC recommends annual visits. You see your doctor, your GYN, OBGYN. It's mostly GYN unless if you're pregnant. You want to do it once a year, but I'll get back into that. So, what is cervical cancer? Cervical cancer starts in the linings in the cervix, the lowest part of the uterus, where people say your womb, and also the other part that connects to the party. So, there's two parts of the cervix. The part that when we open up, we see, and then this part is behind there that connects to the womb. So, all of that whole area that when we check for the virus and all that, we check in the entire area. So, so the cervix connects to the body of the uterus and which is the upper part where the fetus grows, and to the vagina. Quick tip: this is gonna be an adult conversation, so if you have younger children watching, you may want to, either let them watch and explain it to them, or make sure that they're not watching if you're not ready to have that conversation yet. Okay, so the cancer starts when the cells in your body begin to grow out of control. All right, and like I said, the cervix is made of two parts. I told you, endo and in exo. So we're gonna go into statistics with cervical cancer. About 14,100 new cases of invasive cervical cancer will be diagnosed this year. About 4,280 women will die from cervical cancer. Now, like when I talk about statistics, most people, it seems abstract for most people because they're like, okay, what is those other people? I don't know them. Is this another 4,000 people that I don't know? Or it's 14,000? But just remember, always remember, you should count yourself in that statistic and also count a family member, a friend that you know. So when you think about it that way, say this is more personal. It's not, and it's not based on like race and this and other things. Like anybody's susceptible to it. Okay, so there are different certain type of cervical cancer, but usually when you hear the word cervical cancer and you even hear cancer, you're not even caring about what kind you have. Like the squamous cells carcinoma, that's the most pervasive type. Adenocarcinoma and adenosquamous carcinoma, that's the one that mixed through there. Okay, so when you get a cancer diagnosis, they'll tell you there's like grade 1 to 1, so it's like CIN, cervical intraepithelial neoplasia. So when they tell you if you have CIN1, that's the one to resolve without treatment. Most time it will resolve without treatment. 2, it may progress to cancer, and 3, it's very severe, and then most likely will progress to cancer. So that way, when your doctor talks to you about it, they'll know. Okay, not most people, the cervical cancer, most people have the virus, the human papilloma virus. It usually doesn't progress to cancer, but in some people it does. Let's say you've been having it for a while, and then later on in your life, that's when it progresses to cervical cancer. So you may not have any symptoms, and so and then before you know it, when you go for one of your examinations, and that's when it's found out. Okay, so early signs and symptoms. Because most of the symptoms of cervical cancer kind of mimics other cancer in that, like I said, I told you gynecological cancers, which anything there from the uterus, from the ovaries down. Um, it mimics some of the symptoms of the other cancer, and sometimes it could just be something that could be just ordinary stuff. So it's best that you get your checkup to make sure that it's not anything more than that. So mostly would be bleeding after menopause. That is when you no longer see your period for 12 months, like I told you guys before. Menopause is 12 consecutive months of no period. Not if you see it for 2 months and you don't see it again for 3 months, no period. So if you start bleeding, having vaginal bleeding after menopause, you want to go get that check. Okay, abnormal vaginal bleeding, especially beyond your menstrual cycle. You have your menstrual cycle. For most people, it's like 4 to 6 days. Sometimes it's like 3 to 4, depending if you on any oral contraceptive or any method of contraceptive. So if you see that bleeding more longer periods, or you find yourself spotting, you want to make sure that you check with your doctor on that. If you're having painful sexual intercourse during and after, that is another sign. When you're having severe pain, when you come to the doctor's office to get your examination and you're in severe pain when they do an examination, that's also could be a sign. And pelvic pain, like probably lower your belly button area, that part way down there closer to your hip area, that's a pelvic area. If you're having pain in that area, that's usually a sign that you want to make sure that you see your doctor. Men can also get cervical cancer, but in men it's not cervical cancer because men of course don't have cervix. So in men it's usually they will have like throat cancer, they'll have like esophageal cancer, stuff like that. In men it's like constant coughing, weight loss, difficulty breathing, the voice changes, you see this changes in the neck area, usually that's a sign that they have it, because the viruses that the human papilloma virus can grow anywhere in the vaginal area, in the anal area, and if you're having other kind of sex or sex and all that, that can travel and you can get cancer from that. So risk factors is like, it's mainly like I say, multiple sexual partners, you know, you want to get people who are not infected, but you won't know that. Some oral contraceptives can cause it. Early sexual encounter can cause it, but if those people you're doing it with, if they're not, if they don't have the virus, then of course you're not going to get it. But it's always just best to, this one of the causes. They're not too sure yet what it is genetically passed on. They're still working on that, so I can tell you that. All right, so screening. All right, screening, they recommend for you to start regardless of when you start having sex and all that. They recommend starting at age 21, and then every 3 years, depending on your specific findings, personal history and family history. Because somebody could go there and say, oh yeah, I'm doing it, I'm 21 or 22 when I start, and they say I don't have to go back for 3 years. Well, if the doctor finds something and they say they want you to come back, or your family history, like I said, the genetic thing and all, you want to make sure you follow it. Don't say because they told us that we're not supposed to do it more than this time, so I'm not coming back. You want to make sure you come back, because the thing with cancer, if they tell you to see something and you don't follow up with it, it's not going to stop growing. Okay, so you want to make sure, let them go back and look and see and be like, okay, what we saw is not what we thought it was. We just keep an eye on it. So you want to make sure you have that guarantee, or at least that awareness that it's not what it is right now, but they're going to keep an eye on it. Just make sure it doesn't get worse. Okay, so be advised when you go to your pap smear, when you do your annual event. 'Cause some doctors still want the annual thing. They won't be checking for the virus, but they still want you to come because they look at other things. I'm not a human. I'm not women's health practitioner, but I am trained to do that because we had to do that to, to be family nurse practitioner. You have to know everything. So we cover everything. And luckily, my preceptor, he had so many patients that I did at least 200 over 200 pap smears. So I'm pretty good at it. All right. So be advised when you come for your pap smear, your GYN examination. You'll be getting other gynecological care. We'll be inspecting the full vagina for lesions, for discoloration. We'll be checking the uterus also. We'll be discussing contraceptive options. We'll be talking about safe sex, discussing infertility issues if you have it, menstrual irregularities. We'll be talking about pregnancy, because if you've seen an OBGYN, they're going to be talking about the pregnancy part as well. We're going to be discussing breast cancer, because we also do the breast when we examine the breast while you're there. We'll be discussing other things like uterine cancer and ovarian cancer. And ovarian cancer has no symptoms whatsoever, none. So domestic violence, mammograms, and other obstetric care. Okay, so the goal of the screening is to find precancer cancer early when it's more treatable and curable. The thing, like I always say, with any kind of cancer, you want to make sure that you get detected, you get found out sooner than later. All right, and regular screening can prevent cancer, cervical cancer, and save lives. Okay, so I'm gonna go in here. So I'm gonna and they look for the different types of cancer. But like I said, once they tell you certain things, your mind just goes blank when they tell you that's what's going on. So I'm going to discuss, when most people don't know, I had a couple of patients when they came for their examination, and they had no idea what we're going to be doing. Like they were like, oh, okay, oh, you want me to do that? You're going to be doing that? Oh no. And it's uncomfortable, put it that way. It's not like, okay, I'm going to the GYN and everything is going to be fine. No, it's not something that anybody finds comfortable. All right. So but when you go to the GYN's office, right? Let me just put this down. You go in there and you meet with the nurse, or the medical assistant is there, depending on what staff the office has. And they will do your urine test. And also, if you're pregnant, they do the urine test first. If you're pregnant, we don't do the HPV stuff. No, we don't do the internal examination. And then you go in there, they'll tell you, take off your clothes, take your bra off, keep it off where you can snap it off. And of course, you have to take off your underwear. Once again, I'm having an adult conversation. So if you don't want your kids listening, move them away. And okay. So when we do that, you get in there. We're there. We get you. You sit on the stretcher, not stretcher, on the bed. You put your foot in a footrest. We don't call it stirrups anymore, because it has a negative connotation. So we do that, and then we look there. When I'm doing that, I'm talking to you and making sure you're nice and relaxed. Okay, because when you tense up, it makes it a little difficult to do the test. We look at the vagina, look and make sure, again, like I said, we're making sure the pubic hair distribution. We're making sure there is no rash. We're also making sure there's no lumps and bumps and everything else, nothing that looks out of the ordinary that, again, we might bring that may signal an infection or something else. And then we get the speculum. Is a device where, because you have to open it up, the vagina in order to see the cervix. The cervix lies behind the vagina all the way past the birth canal there. So we open that up and then we look at it. It's not supposed to be bleeding red and all if you're not on your period. We take the brush, we go in there, go inside. We scrape that up and put it in the solution, and then we also scrape on the outside, the part that we see, we scrape that up and put it in the solution. Also, we send that to the lab. Then we put our finger in, make sure we check the ovaries, make sure your ovaries are okay. They should be nice and moving around with no pain. And we also check for your uterus, because as you get older, the uterus starts shrinking up, because then you no longer need it anymore, and you're not putting out that much hormones anymore. So that's how it's supposed to be. And then we do that. We check. We press down on your mons pubis, across your hip area, and making sure everything is fine. And then after that, it's done. The whole thing is about 5 minutes. It takes about 5 minutes. Yes, you're being a doctor's office waiting for us a little longer, but it takes like 5 minutes, and 5 minutes could save your life. So just remember that. And then we're done. We'll check your breast first before we start doing that, and then we're done. And then we'll send it to the lab, and the findings should be back. Most of the time, it's like 48 to 72 hours. And when we do that, and then we send that to the lab, like I said, and the lab will call us, and we'll call you back. And we'll call you and say, some doctors will say, if you don't hear from me, that means everything is fine. And some people are like, oh no, I want to hear from you because I want to make sure. And some people, like, you can make an account at the lab to get your results. But I always tell my patients, when you make an account to get the results, they will send it to us first before they send it to you. So if I'm in family practice, if they send it to me, then I'm going to refer you to GYN. If you've seen a GYN in person, the GYN would be getting that. And if you get the results, so if it's going to take us a little while to call you back, don't panic. Don't go looking on Google and getting all these results. That's going to drive you really crazy. Okay, so just make sure. And they do that. So right now, the recommendation for people, for women to get the Pap smear, women ages 21 to 29, you should have your Pap smear performed every 3 years. Like I said, nothing under 21, because before they were doing that when women were younger, young girls were younger. But because every time we scrape or do anything, or if they have to do a biopsy, if they see anything different, that was compromising the cervix. And if you have a compromised cervix and you get pregnant, sometimes that could lead to miscarriage, because the cervix has to stay intact in order to keep the uterus, everything closed up to protect the baby. So we don't do that anymore. And we tried, like I said, and then we weren't doing it every year either, because that was also compromising the cervix. You're supposed to do that every 3 years, but however, health experts recommend you get tested annually for sexually transmitted infections if you're sexually active. Women 30 to 65 do the co-test, which includes the Pap smear and the HPV test. You do that recommended every 5 years. Again, you're going to be checking with your doctor to make sure that your first initial findings, your family history, your sexual history, and everything. So that could be different. And if you're over 65, depending on if you had negative tests for 10 years straight, if you had age 65, you get that done. You don't have to get it done again. But after age 65, if you start noticing bleeding after age 65, you do want to get that checked, because you're not supposed to be bleeding after your period, after your menopause, and you're not supposed to be bleeding that long into it. So you do want to go and get that checked. Even if you do not have a Pap smear, every now again, you want to make sure you go to your doctor and have your annual preventative test and women care visits. Okay, so prevention, they have the Gardasil. You've seen the commercial where it's the Gardasil injection, vaccination, everything. People would think when you say shot, that means it's not. It's shot, immunization, vaccination, they're all the same thing. Starting age, this between age 9 and you get the second one at age 12. Right now, I think you can get it up to age 40, but if you have children good enough to that age, pubescent age, you want to make sure you speak to the pediatrician and get that. I don't think it's mandatory yet, but I think the guidelines are coming and trying to make it mandatory eventually, because you want to make sure that, okay, if you had a chance to save your child's life way later and you can save it now, wouldn't you take that chance? Like you see the commercial where, dad, mom, you knew that you could have saved my life as I got older. Didn't you know this? So you want to make sure you speak to them about it and discuss it. It came in the market. It's been on the market now for almost 20 years. So talk to your child's doctor, get some more information, and then go on from there. Prevention, recommend 1926, because it's not going to protect you against every cervix. There's different strains and all that too, but it protects against most. Limit skin to skin contact, especially with somebody if you're not in a monogamous relationship. The thing is, you could be wearing a condom and all that, but it's literally skin to skin, and you can also get it anally too. So through oral sex. So once you come in contact with that virus, you get in come in contact with it. You can't protect it everywhere. So the best thing is like stay in a monogamous relationship. Um, Let me see here. And even though limited, but even though you can still pass it on, even if you're asymptomatic. So you want to make sure you do that. Treatment, if they tell you that if you have the test done and they say they see something precancerous or cancerous and all, they will tell you follow up a pap smear maybe like 3 months later or 6 months later, and then follow up a year later. So we want to make sure. And some people, they see if they, depending on, like I said, the number and the grading, they might do a colposcopy where you come to your doctor's office and they do the same position, but then when they open up there and take the sample of the skin itself, go all the way deep inside and take a sample of the skin. So colposcopy, the biopsy, and then send that to the lab also and check from there. If it's positive, anything you need to be seen by the oncologist, which is the cancer doctor, then they will refer you to an oncologist. Because the treatments are numerous, so it's not one size fit all, and depends on your medical history and all. And if you're younger, your childbearing age, you still want to have children, all of that can dictate how the treatment is going to go. Because for somebody who's like older, it'd be like, okay, we can go ahead and do maybe chemotherapy, radiation. We're not worrying too much about the fact that you won't be able to have any children anymore. Do we want to preserve the cervix for pregnancy? If you're younger, all of that would dictate what kind of treatment. There's so many treatments on the market too. So in practice, so that your doctor would be the best person to explain that to you. And like I said, also depending on your ability to have children after that. So and the people who will be involved with it would be your PCP, your OBGYN, and the oncologist, which is the cancer doctor. If they have to do anything, of course they do, then they will tell you some holistic issue. Because people, for some reason, people think that, oh, because I'm doing this, so I'm not doing the holistic part. There is no way we're going to say, oh, you even have to go to therapy. There is no way we're going to be like, okay, if you're going to therapy, what are you doing outside of therapy? Are you going out? Are you hanging out with family? Are you doing things that are going to make you happy? Are you doing things going to church or to the mosque, synagogue, or whatever? Are you doing anything that's going to keep your anxiety level down? So it's not just the medical part. We're doing all of that in the natural part, because all of that, we, like again I said, when I do this, it's mind, body, and soul. So you're taking care of the whole person. You're not just taking care of one part of them. You're taking care of the whole person. In as much as also you're also taking care of the family members, because any kind of cancer, especially for the mother, and I shouldn't just say especially for the mother, anybody in the family, it affects the whole family. So you're going to be taking care of the mother, and you're also going to be, you can be taking care of the father, the children, and all. You're going to be making sure that they're being cared for. All right. So, in conclusion, get tested when you're supposed to get tested, making sure to call your friends, people who you love, sisters, cousins. Ask them, maybe like, did you get your GYN visit? You don't have to get all graphic about it. Did you get your GYN visit? Making sure you do that when patients come to me, when I'm seeing patients for the first time, I make sure I ask them questions about that. I always have to make sure that, because by law we're supposed to, screening was supposed to talk about all that when it comes to women of childbearing age. Now, when women 21 years or and older, period, we talk about that. If the children, if they're younger than that, they're seeing a pediatrician, and the pediatrician will be talking about safe sex and making sure you get the Gardasil vaccination and all. So make sure you're following up with your doctors, okay? And if they tell you to follow up, if they see something, if you start having those symptoms that I talked about, you want to make sure that you get the check. All right. And let me just see. I think I saw one question here. I'm not sure. I don't know what that person is. So I don't see any questions. And so it's like I said, make sure you follow up with your doctor. And as always, you want to make sure that you checking, getting you doing your monthly breast exam. There's still thing about whether you should get a monthly breast exam or not, because they're saying that most people do it, and like, as soon as they feel anything, they want to go get a biopsy, they want to get this, they want to get that, and being exposed, unnecessarily exposed. But when it comes down to it, most people find thing about their breast from feeling, especially when you're younger too. So, but talk to your doctor, find, listen to them, listen to the guidelines, and the best way to move forward. And if you have any questions or comments, you can leave it below. And also, for those of you who don't frequent Facebook that much, I am on YouTube, Abby Tyler's Healthy Living on YouTube. And I will answer any questions later on if you guys have questions later. Okay, so I am going to be on tomorrow to talk about congestive heart failure, because I've seen that a lot, going up and down my page and my timeline. And February is Women's Heart Health Month. So and what it is going also like Valentine's Day too. So we're talking about the heart and we're talking about women's heart health month. So we're going to be doing that next month. So it is almost 25 minutes now, and I made that. And I'm going to try my best to be bringing more quality videos to you guys. So if you have any questions, make sure you leave it below. Click like if you enjoy this program. I hope it was informational, and I hope I answered. I was comprehensive as much as possible. There's no way to be completely on here and say everything that needs to be said. So I thank you all for watching. For those of you who will be watching later, I say thank you. For those of you who are watching now, I say thank you as well. And until we see again, good night. Oh, the Jenny Jackson program's coming on now, so I'm sure a lot of people will be watching that. It's coming on Lifetime. Okay, so for those of you who are in my generation and a little younger than me, I'm sure you're going to be glued to the TV. Okay, thank you. Stay safe, stay healthy, and I will talk to you guys. Hopefully, I'll see you guys tomorrow. The CHF show will be at 5 o'clock tomorrow, 5 p.m. Eastern tomorrow. Okay, thank you and have a nice day. Stay safe out there. Okay, bye.